Common complaint I always hear in the office is, I don't have the time, I don't have the space to do my stretches throughout the day because I'm at work, I have a small cubicle, a desk area. So beautiful answer is we have stretches and exercises you can do at the comfort of a small space area such as your desk or cubicle or at home in a chair. So first thing I'm going to go through here is, let's say you have some nagging low back pain, some hip pain, maybe some radiating pain, sciatica, things of that nature. These are beautiful stretches that you can do throughout the work day, and I would highly recommend you do them as well. A lot of stress and pressure can be found right in here, especially if you're like majority of Americans and you're in that hunched over work position. I know I find myself like that as well. When I'm at the end of the day charting like this, I slowly find to come like in that position, and Dr. Sarah is always yelling at me to straighten up and do my stretches. So here I am yelling at you to do your stretches. Here we go. So first thing I'm going to do is I'm going to take my hands, I'm going to grab underneath my leg here, and I'm going to lightly pull up towards my chest like this, okay? Hold for about 10 to 15 seconds, could be a little bit less, could be a little bit more, but you never want to go above about 15 to 20 seconds. Lightly bring it down. Same thing on the other side. Grab underneath that leg and pull towards your chest. Make sure you're not grabbing on top of your knee, because what happens is, you can see as I'm doing that, pulls my knee joint a little bit more, and a lot of us out there have a lot of knee joint issues, so I want to try to limit any more stress and pressure on that joint. So I grab behind the knee, and you see I'm not bending and closing that joint anymore, okay? That's the first one. You're going to do both sides regardless which side you have pain on. Second one is, you've probably heard of a muscle, it's a hot topic these days, piriformis syndrome. We're going to have you cross your leg over like this. Take your hand on top of that knee and gently push down. Now the beautiful thing, if you're at work, you have a nice little backrest here. If you notice, I'm sitting slightly away from that backrest. Back up nice and straight. You're crossing that leg, pushing down nice and easy on that knee, and then you're going to lean back right to about the point where you're about to touch that backrest. Okay, keeping that same pressure right on that knee. Now if that causes more strain and pressure, you can just push down without leaning back, that's okay. Or you can even slightly come forward. If you are coming forward, however, you want to make sure that you're not slumping down. Keeping that back nice and straight, bending and hinging at the hip joint, adding pressure constantly to that top of that knee, okay? And again, that would be both sides. Second part of that stretching exercise is we're going to have you cross your leg a little bit tighter. Grab around the outside of your knee this time, not the front, but the outside. That again is going to limit the amount of stress on that knee joint. And you're going to give yourself a nice big hug, pulling that knee joint to that opposite shoulder. Okay, and you're going to do that again for about 10 to 15 seconds. Slowly release, unlock your legs, do to the other side. Okay? Another thing you can do, let's say you have, I might have mentioned in the office, like a disc bulge, or let's say we have a minor disc herniation. This is something that I would highly recommend you do outside of getting up out of your chair every 10 to 20 minutes, okay? Even if it's a matter of just standing up, I'm going to give you a stretch here in a second that you can go through. Just to alleviate that stressful seated position, that's great, but this is also something you can do conveniently in your chair. So you're going to come again to the edge of the chair, a little bit of space here. You're going to put your arms on the inside of your leg, nice and slowly. You're going to drop down to one side. If you have pain more on one side, you want to actually drop away from the side of pain first. So for this example here, I'm going to say my pain's on my left, and I'm going to drop down opposite to my right, and then drop down to my left like this, and let my arms and neck hang like so. Okay? Now I'm going to show you from the side here so you can kind of see what that looks like. Again, arms on the inside of your leg. You're going to drop down first away from the side of pain, then the side of pain, and then drop down nice and easy and slow, letting your neck and hang, everything kind of holding here for about 10 to 15 seconds. After that 10 to 15 second time period, you're going to put one hand, the side of pain preferably, on your knee, tighten up your stomach, and slowly come up out of that position, helping yourself up. I'll show you from the front here again, going down away from the pain, down to the side of the pain. Let everything kind of just relax there, 10 to 15 seconds. Come back up the side of pain to the non-side pain, pulling back up, keeping your stomach nice and tight. Now that one's tricky. If you do have things like vertigo or things of that nature, you get dizzy, high blood pressure, make sure that you check with me first before doing that, or with your primary care physician. But that's a great stress to kind of open up those joints in the back. So if we're talking about disc bulge, minor herniation, that's a beautiful way to alleviate some pressure there.